Welcome to practice in the primary healthcare setting. The intended learning outcomes include work as a part of an interdisciplinary healthcare team in a primary healthcare environment, recognise impact of a health problem on a person in the primary healthcare environment, provide health education and health promotion for illness prevention, perform nursing interventions that support a person's healthcare needs, and evaluate the outcomes of planned primary healthcare. What is primary healthcare? It is the contact the individual has with the healthcare team, the first contact for families and communities across Australia. It incorporates health promotion and education on prevention of illness and community care while focusing on personal holistic care. The interconnecting principles of equity, access, empowerment, community self-determination and intersectoral collaboration. It has at its core an understanding of the determinants of health, which are social, economic, cultural, political and environmental. Primary healthcare services will also look and operate differently as one moves from metropolitan areas to rural and remote settings. There are significant variations which may relate to geography, community and population characteristics, socio-economic circumstances, infrastructure, health status and workforce mix and availability. Health services in rural and remote areas are particularly dependent on primary healthcare services, particularly those provided by GPs. The social determinants of health strongly influence the health of individuals and communities and affect the sustainability and accessibility of health services. It is therefore important that primary health service planning and delivery recognises the influence that factors such as housing, education, employment, infrastructure and transport can have on the health of those who live in the community and build partnerships across sectors when there is a need to address specific issues affecting a community. Primary healthcare includes GPs, nurse practitioners, midwives, nurses, diabetes educators, PCAs and health visitors. The nurse practitioner role includes assessment and management of clients using nursing knowledge and skills and may include, but is not limited to, direct referral of patients to other healthcare professionals, prescribing medications and ordering diagnostic investigations. The nurse practitioner role is grounded in the nursing profession's values, knowledge, theories and practice and provides innovative and flexible healthcare delivery that complements other healthcare providers. The practice nurse is a registered nurse or an enrolled nurse who is employed by or whose services are otherwise retained by a general practice. Practice nurses work in collaboration with general practitioners, providing a range of services including chronic disease management and population health activities. Their role is diverse and influenced by factors such as the practice population, nurses' qualifications, practice structure, professional standards, and national incentives programs. The purpose of practice nursing is to enhance the quality and delivery of healthcare in the context of general practice. This is a cooperative model of healthcare in which the nurse employed by a general practitioner plays a complementary role by providing a variety of services ranging from clinical care and service coordination to maintaining good health through screening, health promotion and education for individuals and the community. The role of the practice nurse may vary from one setting to another. In some rural and remote environments, it may involve advanced nursing practice. In some, the practice nurse may be located away from the main surgery or work directly in the community as part of the practice team. In particular environments, it may require specific skills and experience, for example, in Indigenous health or aged care. Advanced practice nursing defines a level of nursing practice that utilises extended and expanded skills, experience and knowledge in assessment, planning, implementation, diagnosis and evaluation of the care required. Nurses practising at this level are educationally prepared at postgraduate level and may work in a specialist or generalist capacity. However, the basis of advanced practice is the high degree of knowledge, skill and experience that is applied within the nurse-patient-client relationship to achieve optimal outcomes through critical analysis, problem solving and accurate decision making. It incorporates health promotion, illness prevention, health maintenance and home support, community rehabilitation, pre-hospital emergency, medical services, coordination and referral to other areas of healthcare. The World Health Organization, or WHO, Alma Ata Declaration of 1978 defined primary healthcare as essential healthcare based on practical, scientifically sound and socially acceptable methods and technology, made universally acceptable to individuals and families in the community through their full participation and at a cost that the community and country can afford to maintain at every stage of their development, in the spirit of self-reliance and self-determination. It forms an integral part of the country's health system, of which it is the central function and main focus, and of the overall social and economic development of the community. It is the first level of contact of individuals, the family and community with the national health system, bringing healthcare as close as possible to where people live and work, and constitutes the first element of the continuing healthcare process. Primary health care is socially appropriate, universally acceptable, scientifically sound, the first level of care provided by health services, maximises community and individual self-reliance, delivered by a suitably trained workforce, involves partnership with other sectors to promote public health initiatives. Comprehensive care includes health promotion, illness prevention, treatment and care of the sick in the community. Advocacy and rehabilitation are key components of delivery. Australia's Primary Healthcare Strategy. A national primary healthcare strategy was introduced in 2010, incorporating a set of building blocks and priority areas to be addressed by Australian governments to improve health outcomes. In 2011, a National Health Reform Agreement was established. The national government worked with state and territory governments to develop a primary healthcare strategic framework, and this strategy takes a broad focus and extends beyond the general practice of traditional Australian government responsibility. It accounts for community-based PHC to respond to the needs of local communities by focusing on the integration of PHC with specialist care and other health sectors, including aged care, community care and Indigenous health services. The Australian Government has developed a key portal, Access of Health Reform Information, which is frequently updated on progress and with publications. Primary care versus primary health care. These terms are often used interchangeably. The structures and practices of the primary care sector are not necessarily compatible with notions of comprehensive primary health care, but the latter extends far beyond medical service provision to encompass a whole range of system responses to reduce the effects of disadvantaged health outcomes. Primary care, the shorter term, describes a narrow concept of family doctor type services delivered to individuals. Primary health care is a broader term which derives from core principles articulated by the World Health Organization and which describes an approach to health policy and service provision that includes both services delivered to individuals and population-level public health type functions. Primary care refers to a person's first point of contact with the health system and involves the management of a person's illness or disease condition in a service that is typically contained to that care setting. This first point of contact usually includes the general practitioner or family physician. Nurse practitioner clinics function in the same way and are mostly based in rural and remote settings. What other examples can you think of that provide this service? Please post to the forum. This is a diagram of the differences between comprehensive and selective primary healthcare models. Various Australian PHC organisations have outlined their vision for Australia's primary healthcare system, and these include Australian Medicare Local Alliance, Australian National Preventative Health Agency, Australian Medical Association, the Australian Nursing and Midwifery Federation, Australian Primary Healthcare Nursing Association and Public Health Association of Australia. The nurse plays a critical role in dealing with problems of access within the primary healthcare system. The role and scope of nursing in PHC is continually evolving in response to various changes and pressures in the health needs of Australian communities. Such changes or pressures include an ageing population which places greater demand on health resources, coupled with PHC workforce shortages. The multidisciplinary role of nurses as a healthcare provider, educator and advocate means that the strain on other PHC resources can be alleviated through integrated practice involving both general practitioners and nurses. Nurses in the Australian primary healthcare. According to the report Primary Healthcare Reform in Australia, the participation role of nurses in the delivery of PHC services within general practice settings has substantially increased. The number of registered and enrolled nurses employed in general practice, termed practice nurses, has increased from approximately 3,200 practice nurses in 2003 to approximately 8,200 practice nurses in 2007. Nurses currently work effectively and collaboratively with GPs to deliver a range of PHC services. Nurses have a pivotal role in supporting patients in the optimal management of their health conditions, leaving GPs time and resources to allocate to more complex clinical care. Australian practice nurses undertake a broad range of healthcare activities, sometimes unrecognised under the current financing arrangement, and these activities include facilitating or providing preventative health education programs, delivering quality chronic disease management and care coordination, supporting patients with self-management of chronic conditions, monitoring and facilitating patient recall and reminder systems. Among the benefits of the expanding role of nurses are reducing GPs' workloads, increasing collaborative care between GPs and nurses, and enhancing the quality of care delivered. The Australian Journal of Advanced Nursing documents many of these benefits. In particular, see how general practice nurses view their expanding role. The Practice Nurse Incentive Programs. The role of the practice nurse will further expand through the Australian Government's commitment to reform. Medicare rebates extended in November 2010, enabling nurses to receive rebates for services they provide outside of public hospital. Rebates for nurses under the Pharmaceutical Benefits Scheme have also been approved by Federal Parliament. Nurse Practitioners Clinic Australia Medicare rebates are available. Medicare Australia, the Royal College of Nursing in Australia makes suggestions for further developing the role of nurses in PHC. Two of these suggestions are establishing funding incentives to increase the number of specialised advanced practice nurses and nurse practitioners, and establishing a national funding initiative for supporting research in the area of nursing. Primary Healthcare Nurses Program aims to enhance primary healthcare services for smaller communities, such as populations with less than 1,000 within the Riverina boundary. Nurses are working collaboratively with GPs to provide access to clinical care, health promotion and chronic disease education and support. Nurses provide a broad range of clinical nursing services such as vaccination, wound management, preventative women's health, health assessment for all ages and chronic disease education. Practice nurses play an essential role in delivering care and advice in pandemic situations. The Australian Nursing Federation and Royal College of Nursing provide guidelines for practice nurses to respond to an influenza pandemic. These guidelines emphasise the nurse's role in preparing and managing the general practice response to a pandemic. Nurses in the community. In some areas of Australia, nurses have made a significant impact on community health. Community health nurses provide a comprehensive range of health promotion, early identification and intervention services to children, young people, adults and their families. The work of community nurses is supported by the Community Health Nurses Western Australia, which developed the competency standards for community health nurses. Nurses in Northern Territory High School, their roles are moving beyond healthcare settings and into community settings such as schools. For example, nurses in a Northern Territory High School facilitate and support many health-related programs for students and staff. The nurse's role in this environment is to collaborate with school communities and professional staff in activities, implement health programs, undertake health assessments, prescribe medication, make referral and preventative health care. Nurse the Nation is a site where you can find employment and work in remote and outback communities. Thank you.